So what are the main clinical advantages of using this technology with what's called fresh fractures?
So when you have a fresh fracture, usually in order for the fracture to heal, you need to stabilize the fracture so it can grow and connect.
Mm-hmm.
This is done either by surgery with plates or screws or nails, or conservatively,
Yeah,
yes,
with
with a
cast.
cast,
Yeah.
yes. In any case, when you immobilize part of the body, there is a physical deterioration. So you have atrophy of the muscles, the ligaments are shortening, and it creates damage. This damage is later on, after you finish the healing and the recovery, you need to do physical therapy and rehabilitation to gain the initial abilities that your body had.
Especially among the elderly population.
Yes, especially among the elderly. When you talk about elderly patients, there are also higher mortality rates. It's, as you said, it's very important, especially for older patients, but also to young people which are very active and want to get back being active.
Right.
So if you shorten the healing duration, you basically minimize the damage to the tissue that is caused because of the immobilization. So if you immobilize for example, the leg, instead of 8 weeks, you immobilize it for 6 weeks or 5 weeks, there is less damage, you need less rehabilitation. This is one aspect. The other aspect is the cost. So the longer the healing is, people miss more work days. The average cost of a workday loss per fracture in the United States is about $5,000. If you shorten the healing duration by about 30%, it means that you save about $1,500 per fracture. You have 8 million fractures in the United States every year. So these are huge costs that we can save. In addition, medication. The shorter the healing, there is less pain, less medication, less opioid use. So there are a lot of benefits.
So in essence, what you claim is that nowadays you cannot treat fresh fractures with current commercially available devices because they're inconvenient, because they're very cumbersome. But with your solution that we're going to show in a second, that's become feasible. So if pricing is affordable, in essence, you can treat any fracture with your device, which opens a new market segment.
Yes.
Currently not treated with bone growth stimulators.